Hello and welcome. My name is Alan, and today we are going to talk about more of my thoughts on pushing a better way forward. Thoughts on society, views on society. Last time I kind of gave an idea that the base for me would be education. But I think it's supported by other pillars. And one of those we must get and take care of is healthcare. Why in America we live under this idea that insurance is a better way, I do not understand. There are other countries that have health care for all the citizens, better health care, and don't spend near as much because they aren't stuck in the insurance system like the United States is. America is struggling horribly, even with this insurance system. Pulling up from Wikipedia, just where the stats are linked together, if we look at total health expenditure per capita in PPP international US dollars, non inflation and just adjusted, we have a lot going on. A lot of countries are averaging around 2, 3,000, 4,000, 5,000, 6,000 per capita. Not all of them have nationwide health care. But none of them have the cost of the United States. The United States for 2017, 18, and 19 in that order, $10,213, $10,637, $11,072. See, looking at this, the next highest would be looks like it would be Switzerland, which has 7,037, 7,280, and $7,732 for the 3 years. So, it's still cheaper than the United States. The United Kingdom has healthcare to cover everybody. Let's just look at the 2019 non-inflation adjusted. The United States, 11,072. I know the United Kingdom has national health care, $4,653. A difference of um, 6,500 per person. Canada has healthcare that covers everybody. 2019 cost 5,418. Germany. I think Germany has a national healthcare system. Its cost 6,646. Japan has a form of national health care that covers all its citizens. 4,823. You know, it becomes much more clear that the U.S. is spending way too much on a system that's not nearly as efficient as it could be. But yes, clearly we can do much, much more. Let's see. I'm looking at a chart for health expenditure per capita based in US dollars 2017 from the OECD. Um, but yeah, let's see. Norway, it's all household out of pocket and government compulsory payment. There's no voluntary payment, which means there's no at the doctor here. In total, Norway spends around the 6,000 mark. This is 2017. The US spends over 10,000. Let's see. The UK, most of its government compulsory spending, little bit of household out of pocket, and a very small chunk for voluntary payment. It's sitting just over 4,000, while the US is up there so high. And it's broke down government compulsory in a blue bar, which is how much the government pays. There's a pink bar that's household out of pocket, which is usually like how much you pay uh, in uh, in America. It'd be like insurance payments and stuff. And then the voluntary payment, like I said, is usually at the doctor payment. But yeah, there is no country near the height of the US. It is by far the biggest costing healthcare system of these, listed. Let's see. Um, they've got a further inflation adjusted to 2018 US dollars list here on Wikipedia. And some of the countries barely spend anything, but of course the healthcare is very poor. While in other countries, they spend more. And a lot of these are with healthcare for the entire country. And their healthcare is just as good. People often will say, well, the US is better because we do spend more. Not really. Not really. I mean, and to give you a further example of how bad the healthcare has gotten here, 2002, based on 2018 dollars, the cost per capita was 5,332. 2010, based on 2018 dollars, it went up to $7,930. And in 2018, it went up to 10,624. This should worry people. You know, we spend the most by far on healthcare, and yet we can't cover everybody somehow. But there's people in the healthcare industry, in the insurance industry, who are growing obscenely wealthy. So while we're not getting very good outcomes from our healthcare, people are making big, big money. Yeah, the US is just, there is no reason to spend this much. Especially considering how much we have to spend on by ourselves before we can even get help. It's unacceptable. We want to count ourselves as one of the most advanced nations in the world, but we can't guarantee health care to all the people. Think about this. In the U.S. Declaration of Independence, it is written, there are certain inalienable rights, that among these are life, liberty, and the pursuit of happiness. It is hard to follow any of those without health care that guarantees your health. We can afford health care. You know how we do it? We tax corporations, the uber wealthy, cut down military spending, and you've got money for health care, even money left over for free college to help with other issues like infrastructure, to help with all kinds of things. it can be accomplished. It's just that the middlemen who make big buku bucks, the insurance company, they don't want us to have a national guaranteed health care service because it cuts them out. We can negotiate with doctors, nurses, hospitals, drug manufacturers. You know, that's what Canada does. They uh, negotiate with their healthcare providers to be at a realistically uh, cost-worthy price without breaking people. It can be accomplished. It should be accomplished. We need a nationwide healthcare coverage system. People shouldn't be having to go into debt for healthcare. None of the other first world nations have this. Just the US. We need a national healthcare system that covers everybody. And I've already explained it. It can be done. But I'm going to end this episode here. I will have links in the description below the video. As always, educate thyself. Think, read, study, learn. Someone tries to tell you something you have trouble believing, ask them uh, for evidence. But anyway, I'll see you all in the next video. Until then, later.